A lot has changed in the last 3 months. Has it sort of been according to your expectations in terms of the numbers and in terms of how we have been dealing with the disease?
Good evening, Stephen, and thank you for this invitation. There's no doubt that, that this disease cannot be stopped. But what we can try and do is slow it down. And that's exactly what we did. The lockdown really, and everybody accepts, was effective. We were able to slow the rate of transmission, and we can see that in the numbers and in the curves. But the inevitable is still going to happen. And we're already starting to see that. We see that in the Western Cape, where both the number of cases and the number of deaths have been increasing sharply, over the last few weeks, although perhaps even tailing off a little, not tailing off, I guess, flattening a little bit in the Western Cape. But, it's too early to really tell if that means it's reached its peak or not. But what is clear is that Gauteng is, we're a couple of weeks, behind that, and we certainly are following that same trajectory. And we will still reach the peak in Gauteng and, of course, the other provinces too.
We've built new health facilities there, field hospitals now at Nasrec in Gauteng, at the Cape Town International Convention Centre, and at eThekwini in Durban, also Nelson Mandela Bay and an old car factory. At the same time, it would seem that we've prepared for the peak in terms of caring for people with the disease. I have seen a lot of criticism about the lack of investment and time spent on track and tracing. Is that still a weakness? The thing about tracking and tracing is that it works very well in the beginning when the numbers, you have few numbers and you can turn around the test results very quickly, and you need to basically go and, track and trace every contact, which on average is about 20 people per index case. So you can just imagine, that can very quickly become overwhelming. And so certainly in the beginning it was very effective, but as things, have progressed, it's becoming increasingly difficult. But one of the things that is happening and is already being rolled out in the Western Cape, is a track and trace, a mobile track and tracing system where people are contacted on their cell phones, and to try and engage with people on that way rather than, sort of both physically and actually calling everybody all the time, to actually use digital technologies to track and trace. But yes, there may come a point where we really don't have the laboratory capacity to track and trace on a population level. So what happens next? 3 months ago, we knew that the world was about to change. It has. Is it possible to predict how the world's going to change again in the next 3 months? I've seen some people predicting that Gauteng alone will have 1 million cases by the end of the year. That seems very high to me. Is it possible to know what will happen?
So, it's, the modeling or the predictions are, that's what they are. They're best guesses at the time. So we do have to, we obviously have to do them because we do have to plan. But, we do have to take on board that, that there's a big range. And also different models come up with different numbers. So, it's really difficult to be sure. But all I can say is that some of the models, the sort of the short-term models that we have been using are so far on track. And so we'll have to see how, the longer-term models, pan out. But clearly modeling is an important part of this exercise. But, and of course, modeling is done, as I said, without the full information and without interventions. And so as we start to introduce more interventions, hopefully those numbers will also come down.
What for you is the biggest intervention we still need to make, or the biggest intervention we still need to improve on or increase or introduce? What for you should be the priority of the next month?
Well, obviously we have to continue to keep our distance from each other because that's how this virus spreads. Just engaging with people, this virus basically spreads, through aerosols and droplets. And so, it's basically to maintain the social distancing. And so the mask wearing is very important. And certainly I've been very impressed by how the South African public have adopted wearing of masks. And they're also very, people are very observant about continuing to sanitize before they go into shops. So that obviously needs to continue. But, that can't be the way we live,
forever. And so obviously, a vaccine is really what we really need to develop as a global community, because that's really what's going to end this epidemic. Because one of the other things I think people are accepting is that this virus is not going to go away. That it's likely to reoccur, and in fact, we're already seeing resurgences in other parts of the world. But it might also occur every season. It might become an endemic, a bit like seasonal flu. And so in order for us to get back to a level of normality, we really do need to have a level of immunity that one can get through vaccination.
You talk about, the virus coming back. New Zealand has 2 cases today after it declared itself virus-free last week. China now seems to have more cases in Beijing. We don't know if they're imported or if they've stayed there. People talk about a second wave, and the idea would be, as I understand it, not so much that it's a new virus or a different strain of the same virus, although that I imagine can happen, is that we all drop our guard. Really important not to do that, right?
Absolutely, because we're all vulnerable to this virus, and so if you weren't caught in the first wave, you might get caught on the second wave. So yes, so one has to maintain all of those, those prevention measures.
This is a huge test of our medical capacity. It's a huge test of our state and government. It's a huge test as well of whether ordinary South Africans are doing what we need to do. In other words, wearing the face masks, etc., no shaking of hands, all of that. At this stage, are we passing? Do you think we'll continue to pass? Do you think that all of this, the centre will hold, if you like?
I think, there's, as I said, we can't stop this. Well, it's already, as we can see, taking hold in the Western Cape. The indications are that it's going to happen elsewhere. So, we can do our best, but I think we all do have to, be prepared for, for many of us have family members to get ill, but, I also really do want to re-emphasize, that, more than 90% of people have, fairly mild or moderate disease and recover fully. And, that's really an important thing to remember is that this is something that most of us can beat. And so if you do get it, it's just, obviously, very importantly, is to self-isolate so that you don't spread it further. And to, obviously take, the kind of medications that help, but really just to sit it out, because that's what it is. It's something that we just have to live with, as I say, until we hopefully get a vaccine. And of course, better treatments. That's obviously an important thing for those people who are hospitalized, is that there's a lot of work on, developing new treatments.
Professor Lynn Morris, I really do